Good morning, everyone. It's okay to say good morning. I'm Southern, y'all. We need a little call and response here. Y'all, I am Congresswoman Nikema Williams, and I proudly represent Georgia's fighting 5th Congressional District, and I have a feeling for the next 4 years we're going to be doing a lot of fighting here for the women and families that we represent across this country. I also am proud to serve as the Chief Whip of the Democratic Women's Caucus. Y'all, first of all, it's been a long 19 days. It's hard to imagine that it's only been 19 days, but every day, every woman up here and every woman of the Democratic Women's Caucus has taken on this fight to stand up for the women and families in this country. But we've taken on fights long before, and I know that this won't be our last. The Trump administration is attacking us at every opportunity. Just 2 days ago, the unconstitutional, not congressionally appropriated DOGE took on an unprompted and illegal field trip to the CDC, a public health organization that is centered in my district. In the midst of their attack on our Constitution, they're attacking our public health institutions. My office is getting hundreds of calls from constituents worried about these fundamental health centers like the Centers for Disease Control and Prevention, the NIH, and so many others. I heard from one constituent that she is afraid that her son will literally die because of Elon Musk's attempt to take away Medicaid funds. She called the office in tears because she didn't know what would happen if her son, who receives SSI and Medicaid, is not able to continue to get the life-saving treatments that he gets every month. I've even received reports that maternal and child health centers of excellence across the country have received letters to cease and desist all activities. Imagine that. In the midst of the maternal health crisis in this country, and in particular my home state of Georgia, where we continually rank 50th out of every state, they're trying to close frontline support centers. Y'all, Georgia has one of the highest maternal mortality rates in this country, with Black women being 3 times more likely to die from pregnancy-related complications than any of our counterparts. This administration is sending a loud and clear message. They want to take away our reproductive freedoms, and even more than they already have, they don't care how it affects our health or our lives. They've removed reproductive health resources from the Health and Human Services webpage, and Trump pardoned people who had illegally blockaded a reproductive health clinic, telling America that it's okay to harass people seeking the care that they need and deserve. And they've supported legislation that will prosecute healthcare workers for providing vital treatment to mothers. Y'all, I worked for Planned Parenthood for over a decade before I came to Congress, and it's the stories and experiences of the women that I served during that time that I carry with me each and every day, and those conversations guide my work as a member of Congress. As we see an assault on all forms of reproductive freedom, the need for full and equitable access to contraception is at an all-time high. That's why I'm proud to co-lead the Right to Contraception Act that we just reintroduced this week, because until Congress passes legislation protecting access to contraception, our work is not done. The power to make decisions about our health, our bodies, and our futures must be ours and ours alone, not Donald Trump's, and definitely not an unelected billionaire like Elon Musk. Without the interference of any politician, especially those unelected. And now I am proud to turn it over to one of the newest members of the Democratic Women's Caucus who is in this fight with us, Representative April McClain Delaney.